The Ford government releases its latest COVID projections, painting a grim picture of what's to come in early October. 1,000 new cases a day, a rising death toll, and more hospitalizations. But it's not increasing restrictions, at least not yet.
The trends are deeply concerning.
The latest projections show COVID cases in Ontario are doubling every 10 to 12 days. Today, the province's daily total was 625. 2 weeks ago, it was less than half that at 263. And the second wave isn't just spreading among people under 40 anymore. It's now growing in all other age groups as well.
Remember to adhere to gathering limits and wash your hands frequently and thoroughly.
The modeling shows Ontario is on a similar trajectory to Victoria, Australia, which is the pink line in this graph. It brought the wave down by imposing strict restrictions, including a curfew. But the Premier, who's staring at a deficit that's ballooned to almost $40 billion, says the province is not moving back to stage 2 at this time.
You have to measure, the impacts to people's livelihoods. And so I take the economy very, very seriously.
Pressure has been mounting on the government to impose tougher restrictions. The Ontario Hospital Association is calling on it to move the province back into stage 2. The medical director of critical care at Michael Garron Hospital released another scathing criticism on Twitter today, saying hospitals will be overwhelmed if targeted action isn't taken in hotspot regions.
If nothing changes, nothing changes. It virtually assures that we will be in a situation that we're actively trying to avoid.
The Chief Medical Officer of Health says he wants to see what happens first with tighter measures imposed earlier this month, which limited social gatherings and closed bars and restaurants earlier. He says the current trajectory can be altered and cases reduced.
People say, well, how do you know if masking, distancing, washing your hands, staying home if you're ill, all that kind of aspect works? It does, because we did it the first time.
Unlike the first wave, when tens of thousands of surgeries were canceled to ensure hospital capacity, this time the government is trying to keep them fully operational, but acknowledges if ICU cases rise above 350, that will be impossible. Today, there are 35 cases in ICU, but hospitalizations have almost doubled to 150 in the past week.
As we see those cases changing early, we start to get very worried that the ICU use will change in a few more days.
When asked where the problem spots that are generating more cases are, the Chief Medical Officer of Health pointed to banquet halls, restaurant staff that congregate and socialize in the back of the restaurant, and group activities in gyms. Those are likely spots that could be faced with tougher restrictions if and or when they occur.